welcome back to part 2 of our special Christmas episode of The Animal Heartbeat, the 12 heart diseases of Christmas. How was your Christmas Eve, Jose? Was it good?
Well, it was great. Thank you. How was yours?
Yeah, fantastic. I mean, Father Christmas came, the reindeer ate the carrots. This year, Father Christmas had a non-alcoholic beer and a rice cake. So it was big news in our house.
Nice. Ready for our second part?
I was born ready, Jose. Are you ready?
Absolutely. Looking forward to see which diseases you pick as part of our 12 heart disease of Christmas.
I'm going to warn you, there's going to be some obscure ones in the second half.
I'm scared.
That's appropriate. Excellent. Let's get into it.
On the 5th day of Christmas, my true love sent to me.
This is going to be called 5 Kissing Bugs. Excuse my singing. Maybe we should get someone to sing us a version of this that's better. So 5 Kissing Bugs. So this is myocarditis caused by Trypanosoma cruzi. Trypanosoma cruzi, thankfully, because of temperature, lack of reservoir, etc., is not in Northern Europe. So it's not something we see, but it's very common in the southern USA, especially Texas, Mississippi Delta, Central America, South America. There's a lot of cases of this in dogs and in humans. So if you look at the work from Texas A&M, especially Ashley Saunders, they've published a lot of work looking at trypanosoma myocarditis or Chagas disease in dogs as a model of the human disease. And there are different phases. There's acute infection, there's chronic infection, and then there's the sort of residual scarring that's left. This would be under our number 12 disease, our day 12 disease, that the DCM phenocopies. So, you may have a dog presenting in the chronic phase of Chagas disease, where actually they look like DCM. They don't look as if they've got an infectious disease at all. And the only way you can find out what the trigger has been is to run titers to look for Trypanosoma cruzi exposure. So the parasite itself is transmitted by these kissing bugs, these Reduvidae species, and they're horrible little critters. If you Google them, they look a bit like shield bugs, but with a very long nose and very long legs. And they actually pick up the parasite from host species, and it lives in their gut. And one of the habits of these kissing bugs, which is particularly disgusting, is they bite the dog, or in fact the person, and then they sort of defecate and smear it around, and the parasite has been in their gut and comes out in their feces and goes in through the bite. So it's not in the salivary glands, it's actually in the hindgut, and it passes into the body. So this is a common cause of active inflammatory myocarditis in these cases in the US and Central America. And it's a horrible condition. There's actually not a great treatment for it, even in 2023, 2024, we're not looking at a disease where you can treat the parasite effectively. A lot of the drugs that are used in humans are very reserved for humans and really shouldn't be used in dogs. So it's a real challenge. It's a real challenge. And sometimes you don't even know the dog has been exposed. So you don't find it in the acute phase. You find it after the damage is already done. So even if you could treat, sometimes we're just dealing with the phenocopy of DCM in the end. So it's a highly challenging disease, very, very important in certain geographic areas for humans and dogs. And of course, dogs can potentially act as a reservoir for people. So, there are some real challenges in these cases as well.
It's a very serious and sad disease, but very cool, I have to say.
It's super interesting.
Super interesting, yeah.
And, I think in Europe, people talk about Neospora and Toxo, and we say, they can cause myocarditis. Have you ever seen a convincing case report or a convincing case in clinic of Toxo or Neospora protozoal myocarditis in a dog?
No. As you're saying, we always measure it and then look for them, but no, not really. No. We don't have cool bugs around here, except for Angiostrongus vasorum.
Well, we all know that's a cool bug, right?
We did that. That's not in our list.
It's not in our list, but I think it's just so cool. Yeah. We just take it as read.
Yeah, exactly.
It's right up there.
Cool. So I guess it's my turn. I'm sorry if this is not a huge surprise.
On the 4th day of Christmas, my true love sent to me.
So I picked transient myocardial thickening as one of my favorite diseases. And
I am supportive of that choice. I mean, it's an important condition.
And but I did that because there has been this recent case series published from an Italian group, Giovanni Romito, the first author from Bologna, and they describe 27 cases of TMT in Italy. And why I think this is cool? Because our initial case series was 21 cases of TMT. And we recruited guys.
You reckon they recruited those last 7? They were like, we're going to beat those guys, those podcasting
Yeah, no, I'm
guys.
sure.
They can't have the biggest number.
Exactly. And I say, yeah, we have the biggest case series. But the cool thing is we didn't have any we had guys from Switzerland and the UK.
Right.
And so what I think is very neat is what they describe is exactly what we have observed in the UK and Italy.
Absolutely.
So exactly the same disease. So which is very interesting to have a second independent case series in a different country that describes very, very similar features. So again, these were young animals. Like 70% of the cases were less than 5 years old. They had antecedent event, increased troponin I, decreased LA fractional shortening at admission, which then improved over time with reverse remodeling. And so very, very similar characteristics to what we have described in cats a few years ago. And again, the problem with TMT, and that's why I thought it would be interesting again, that's why I nominated as one of the cool diseases, is we don't know what is causing it.
Yeah.
They tell in the Italian case series, they strong believe that could be myocarditis, and in like 26% of their cases, they identified an agent that could be causing myocarditis. There's serology for Bertonel and Toxo.
They're all Bartonella positive. I mean,
yeah,
you know,
true.
my thoughts on Bartonella. Unless you've got it on fish, on fluorescent in situ hybridization on tissue. I just don't buy it. I just don't buy it.
Yeah, especially because we also had a serology positive in our cases, cases that we did not treat, and they still reverse remodel. But even if 1/3 potential or some cases are infectious, then we still have the other 2/3 where or either they are infectious, like viral myocarditis, and as in humans that we don't know because we don't know any cardiotropic viruses in cats, or we don't test for them.
Well, okay, listen, we're going to come back to that. We're going to come back to that in a minute. Okay.
Yeah, exactly. And or again, we don't know the etiology, or they are stress induced. They look like Takotsubo, like cardiomyopathy in humans. So I thought it was,
so that's interesting, isn't it?
Yeah.
You know, for me, I think TMT is a syndrome, not a disease. I strongly suspect there's a couple of different things associated with it. People say to me, "Oh, don't you think it's myocarditis? You think it's stress, not myocarditis." Well, myocarditis means inflammation of the myocardium, right? It doesn't mean infection. Yeah. It doesn't have to be an infection. Maybe it's viral, sure. Maybe it is Bartonella. Maybe I've got no idea what I'm talking about on that front. But who's to say that catecholamine excess couldn't cause inflammatory changes to the myocardium, much like Takotsubo cardiomyopathy
and edema and myocardial edema.
And edema,
right, absolutely, and again, also in their case series, some cats reverse remodel quite quickly, so this needs to be fluid shifts. And so, no, I agree. I totally agree with you. I think this should be considered a syndrome with different triggers. And then we have the nice case series from the manuscript from Joshua Stern on California in cats that survived the California wildfires. That also some cats had TMT. So very stressful environment, and so certainly a lot of stress triggers and inflammatory markers and so on going on. So it's interesting. So I think indeed different triggers may potentially cause this transient myocardial thickening. But yeah, I just honestly loved it that the different case series, even though they were a bit chicken, they wanted to wanted to beat us by 6 cases.
Guys, we've got to wait to get another couple of cases before we publish it.
But still, Romito, congrats. It's
absolutely.
nice
Props,
that you really showed exactly what we have described before.
Do you know that this we're joking about, they just publishing to get more cases than we have, sort of thing. But actually there's a lack of repetition in the veterinary literature. You have one study shows one thing and then everyone goes, "Oh yeah, great, that's it, that's a fact." But then you repeat it, maybe someone repeats it, and the findings just don't add up. They just don't do the same thing because it's a different population. The protocol is slightly different. Maybe it was just random chance first time, that the P less than 0.05. Well, it's a 1 in 20 chance that it's going to come up positive. So, I'm very pro publishing more case series on a particular thing. You describe it once, that's not enough. That's not, with this disease, it's not enough. We need more to understand what's going on. And, our data was published in that 2018 case series, was published on cats from the UK and Switzerland. Who's to say it wasn't Angiostrongylus causing it? I mean, who's to say it's not something that the rest of the world see? This data is published from a different geographic location. It supports that this is a feline condition, not a UK condition. And that's really important, I think. That's really important, especially when we don't know what the hell's going on.
Absolutely. I totally agree with you about that. I think we have a lot this feeling that, okay, this has been published. We will not invest the time to publish again. But especially, we are not talking about our manuscript. We're not talking about 500 cases, 1,000 cases, 2,000 cases. So we publish
it wasn't 10, in 20, nature
30 exactly, and so why not publish it again and see if you get the same? I totally agree.
Absolutely.
Yeah, cool. So TMT, what next?
TMT, an unknown transient myocardial disease. Well, you know what, I've got two. I'm going to give you two now that are are transient myocardial conditions. Now, the first one, I'm going to be honest, this is a human condition.
On the third day of Christmas, my true love sent to me 3 childhood fevers.
This is not something that is published in veterinary species, but why not? Why are we not seeing it? Is there something different? This is a disease called Kawasaki disease. Has nothing to do with motorcycles. This is a condition which was described by Kawasaki, is a transient inflammatory myocardial disease in children. It's also known as mucocutaneous lymph node syndrome. So it's not just the heart that's affected. This is a systemic disorder, and it's well described in humans. And it was described by Kawasaki, decades ago. We still don't know what causes it. There's various hypotheses that it's like a vasculitis of the coronary arteries triggered by some sort of infectious agent, but they can't get to the bottom of what's causing it. And often it's associated with lymphadenomegaly, and typically, the child has a fever, lasts 3 days, 5 days. They may develop arrhythmias. They develop lymphadenomegaly, and that's a big high index of suspicion for evaluating for Kawasaki disease. So this is a syndrome, and it's thought to be associated. Some people have said it might be associated with scarlet fever or rheumatoid syndromes, but nobody knows. Is there something like it in animals? Is there space out there for us to be seeing transient changes in systolic function or myocardial dimensions in puppies, kittens, juvenile animals, 1-2-year-old animals that just self-resolve? And I think if I saw it in a cat, I'd call it TMT. And I'd say, well, there was no recent stressful event. Yeah, whatever. There must have been. The cat just didn't tell us they were stressed. And in dogs, maybe we'd say, oh, maybe it was a septic focus causing systolic dysfunction, that sort of SIRS type inflammatory change that affects the myocardium. So we see inflammation, systemic inflammation causing systolic dysfunction in dogs and cats for sure, especially dogs. And we don't understand what's happening. The treatment for this in people is they often treat with aspirin, and they treat with immunoglobulin to try and deal with whatever inflammation is going on, whatever microvascular disease is going on. Most people recover. Most children recover. Some of them are left with aneurysmal changes to the coronary arteries. So definitely there is inflammation within the wall of the coronary arteries. But many of these coronary aneurysms resolve. The death rate's less than 1%, but the presenting signs can be quite dramatic. I think that's really interesting. So I guess two things that makes me think about, are we seeing it? Or whatever it is, this Kawasaki disease, we'll maybe call it Bourget disease if we see it in juvenile dogs and cats. Would we even know it was there? Because we already have other things that we think explain the changes we're seeing. So maybe we're completely ignorant of this, and we're just saying, oh, it's sepsis or whatever. And the second thing is, I've got small children. I worry about about things like this. Next time my kid has a fever, I'll be like, oh, I'll just check your lymph nodes. I'll just maybe we should just be ordering some immunoglobulin, you know?
Yeah. No, those conditions are very interesting indeed. Like how inflammation can affect the heart.
Right.
It's, as you were saying, the SIRS guys we see in dogs, as the RVC published, those guys with mild pericardial effusion, and we see them, trace pericardial effusion, systolic dysfunction, which is transient. That's indeed very interesting. I always wonder, are there any sequelae? Are there, as you were describing those coronary aneurysms and so on, these guys we see with SIRS, and then the heart improves and so on. But are there any sequelae? It would be interesting to follow also these guys over time. But yeah, inflammation in the heart, it's very, very cool. Well, not to talk about the potential effect of inflammation on HCM and other cardiomyopathies, but that's
inflammatory cells are there, right? I mean, it's part of the histopathological features of a lot of cardiomyopathies. You know, so are they chicken or egg? Are they causative in some way? Do they potentiate the disease in any way? This inflammation, this inflammatory infiltrate, or is it a result of necrosis? It's sometimes hard to know because we often get the histopath at the end of the day, and we don't know what happens over time.
On the second day of Christmas, my true love sent to me.
Leading on from these children with an unexplained fever and lymphadenomegaly, Kawasaki disease, or rather a Kawasaki-like disease, was seen an increasing number in children around the time of the pandemic, of the COVID-19 pandemic. And it's been linked to COVID in children can cause a particular myocardial inflammatory syndrome. And in adults, COVID can cause a frank myocarditis. So can COVID be a problem in our patients? This leads me on to my final top heart disease of 2023 is SARS-CoV-2 induced myocarditis in dogs and cats. It's a controversial area, and the publications out there are sparse and a little bit controversial. Some of the testing's not been brilliant or well validated. And sometimes myocarditis is defined just as an increase in troponin. Now, I think you and I both know that that's not how we would define myocarditis. For me, defining myocarditis would be looking for systolic dysfunction, pericardial effusion, arrhythmias, and an increase in troponin. So it's not just the troponin. So for me, in dogs, certainly I expect that kind of constellation. Maybe they're not all present, but I'd expect more than just the troponin increase. A couple of years back, I saw a dog who had a systemic disease which progressed to myocarditis. And we were all still masked. We were all still socially distancing in work. And I thought, I wonder if this could be SARS-CoV-2 myocarditis. And we did a nasopharyngeal swab, and it was positive for COVID. And the owners had noticed the dog develop initial signs, gastrointestinal signs, when they were on the 3-week lockdown. This is back in 2020. And the dog sadly died, didn't make it. We sent his remains for necropsy with the government agency, and they found COVID all over this dog's body. It was all over the place, in the brain, in the respiratory tract. It was in the heart.
Wow, really?
It's Delta variant. So dogs are not very commonly affected by coronaviridae. They're not very susceptible compared to cats. But I think when dogs do get them, they can be pretty bad. And I saw another dog who survived, who did have a positive nasopharyngeal swab as well, with myocarditis based on my more stringent criteria. So I think it does happen. It's not very common. I think it does happen. In cats, looking at the data out there on COVID and cats, it is reported that cats had high antibody levels in an Italian population back in the lockdowns. IDEX Labs ran a bunch of antibody tests on cats, and they found a number of cats had exposure to COVID, but none of them had blood taken for signs of COVID. They were all having bloods for like pre-anesthetic work or routine blood monitoring or kidneys or whatever. So it seems to be that a lot of cats had some sort of immunologic exposure to COVID, but no signs. And that's always what I thought. And then I saw a case report recently where Valérie Chetboul and her colleagues in France have published 2 cases of a myocarditis, high troponin, echo changes, and lingual ulceration. So big tongue ulcers in these cats, in 2 cats that were positive for COVID. And they were treated and the clinical signs resolved and the cardiac changes resolved. So that's interesting because maybe it's out there and we're not detecting it. Maybe we're thinking it is TMT. Maybe we're thinking it is HCM and we're not looking. In the last 5 weeks or 6 weeks, now I'm going to preface this by saying maybe I don't know what I'm talking about. Maybe I'm seeing shadows and I'm not really seeing something that's a genuine disorder here. But I have seen 5 cases in 6 weeks of cats who presented with acute respiratory signs that really sounded like heart failure, really looked like heart failure on a radiograph, one of them. And on echo, all had myocardial thickening and left atrial dilation. Looked a bit like TMT, quite symmetrical thickening, left atrium not that big. And these cats had troponins that were through the roof. 2 or 3 of the cases, their atrium wasn't that big. And I wondered, well, they'd had some diuretics. Maybe it was, maybe the atrium had been shrunk by the diuretic therapy at the primary vets. One of the cats had a troponin of 35. One had a troponin of 152. I mean, crazy high, not questionable, much higher than I would expect to see in HCM. All of these cats had reversal of the cardiac hypertrophy and left atrial dilation and normalization of troponin in 1 week. Now, that is very fast for TMT. A couple of them had stressful events. My cat has a stressful event every day, so I don't know how reliable that history is. But I wonder if there's something else happening in these cats. I don't know. And I wonder if it's some sort of viral condition. Could it be COVID? I don't know. I'm not suggesting that it definitely is. But I think that coronavirus-induced cardiomyopathy is out there, or myocarditis is out there in the population of cats. There are published cases of it. I think it's there in dogs too. Is it very common? No, I don't think it's very common. Is it something that we can catch? No, I don't think it's something that we can catch. I don't think it's a public health issue, but I just think it's an interesting one. And I wonder if we'll come to understand things a bit better over the coming years as we're less afraid of COVID and we are investigating it a bit more. What do you think? Do you think I'm crazy?
No. Well, I think that would fit the TMT description and diagnosis. We had some cats in the case series, as the Italian group had, that reverse remodeled after a week or 2.
Yeah, it's really fast.
And so it's very fast. I think that indeed would suggest myocardial edema. So I think would tick all the boxes for myocarditis. But as you were saying before, what is the bug? What is the trigger? And then you can, in humans, myocarditis can be caused by a hypersensitivity reaction to medications, for example, and stuff like that. And so there are so many different triggers of myocardial inflammation. That's why I like what you said before, that TMT should be seen as a syndrome with different triggers, and TMT just describes what we observe on echo. We just need to get better at screening for different infectious causes in cats. Viral myocarditis in humans is the most common cause of acute myocarditis.
Right.
We just a bit similar to what Santilli did with dogs, and looking for cardiotropic viruses and so on. We should try to do the same in cats, because it makes sense that coronavirus or others could cause HCM in cats. How old were your cats? The 5 years
range of ages. None of them were very old. I think the youngest was 1 or 2, and the oldest maybe 9. A breadth of ages, both genders.
Yeah. And what I think this is important really is the take-home message for vets, that many cats are presented with very sick ventricles and in congestive heart failure, which may be perceived as a situation of very poor prognosis and a lot of potential investment for the clients and so on. But some of these cases will reverse remodel, and we have an excellent prognosis. I think really what we should say again is that it's totally worth it to invest in these cases, to try to treat these cats, because you never know that maybe after a few weeks they are rare, but the ones that reverse remodel are very rewarding, and these are cats that are back to normal. So it would have been a huge shame to just pull the plug and quit on them.
I think my top tip is measure troponin, because it might change how you think about the case if it's very high.
Agreed.
So but by my calculations, my rudimentary mathematics, we've done 11. Jose, you have the honor of giving us a partridge in a pear tree, maybe?
On the first day of Christmas, my true love sent to me a thrombus in a vascular tree.
And the thrombus in a vascular tree. So I think I would pick AT and thrombus.
Nice.
So there's been a clinical trial called the SuperCat, that the results were presented at ACVM this year. I don't think that the manuscript is yet published, but it's again an attempt to see what's the best treatment in cats with ATE. And these clinical trials are very, very challenging because it's very, very challenging to recruit cases. Many cases will be lost to follow up. So again, congratulations to the authors that have worked on this case, on this clinical trial, and hopefully we'll see it published soon. So my understanding, so they compare SuperCat, they compare rivaroxaban to clopidogrel for prevention of secondary thromboembolic disease. So these were cats that had an ATE and then were started in either rivaroxaban or clopidogrel. And it seems that rivaroxaban and clopidogrel were similar, were equivalent. They had similar outcomes in these cats. We know from the past that the fat cat study showed that clopidogrel is superior to aspirin, and now the SuperCat study seemed to have shown that rivaroxaban is equivalent to clopidogrel. What we don't know, but we'll wait for the result, the paper to be published and so on. What we don't know is if we combine these drugs, combine therapy, dual therapy, clopidogrel plus a factor 10A inhibitor, so in this case, rivaroxaban, is that better just to give one or the other? We don't know that yet. That's an important question because many of us now combine these drugs when we are very worried about the risk of thromboembolic disease. There's only one case series, I believe, from Joshua Stern, a retrospective study that looked at cases where they have combined therapy, and only a small number of cats had adverse events. So this seems to be safe, like 5 out of 32 or something like that. So I picked thrombus because it's so common in cats. Is a dreadful sequela, complication of cardiomyopathies in cats. We have now this new trial, the SuperCat study, which has shown that rivaroxaban is equivalent to clopidogrel. The question is still there. Is it better to combine these two drugs? What's your approach? When do you use clopidogrel, rivaroxaban, or you combine them?
Well, I came across a nice paper actually from the Stern lab, Ron Lee, Josh Stern, and their colleagues, which was looking at in vitro platelet function in cats. And it seemed like clopidogrel and rivaroxaban had a synergistic effect in vitro. Now, that's very different to clinical outcome-based studies, as you know. I think we're working up to a trial there, I suspect. Josh and Ron have done a lot of work on feline platelets. So they're looking for, is it safe? Looks like it's probably safe based on retrospective data. Is it something that has a good theoretical benefit? Yeah, it has. That's what the in vitro study shows. There's a theoretical benefit. So I think the next step there is logically a clinical trial. So hopefully that this is something that there'll be some investigations coming over the next few years. As you say, it's challenging to recruit cases. Trials in cats with cardiomyopathy, especially cats with ATE, are really difficult. My approach, I start them on clopidogrel. I start them when I would classify them as B2. So that's based on left atrial fractional shortening and left atrial size, but mostly left atrial function. If their function is low, then I would classify them as B2. Often their left atrium is large as well. I start them on clopidogrel, 18.75 mg per cat per day, and I see how they get on. And normally I'll pull them back for an echo in 3 months. I don't like seeing them too often. But one thing I would like to know is, are we doing enough to inhibit the platelets? Now, I don't think there's a good blood test at the moment to say that we are doing enough to inhibit platelets or not. But I look at the echo to see, is there a thrombus forming? Is there dense smoke? So I had one recently where there was dense smoke. And I spoke to the owner and I said, well, I don't know that dense smoke is increasing your cat's risk of ATE, but I am worried by that. And the cat was on clopidogrel at the right dose, was getting the dose every day. So I talked to the owner and we said, well, let's switch to rivaroxaban and just try rivaroxaban. See if it does something differently. The cat came back last week. It's no different. It's just the same. Very dense, spontaneous echo contrast. Almost like a wannabe thrombus in the auricle. So now the cat's on both. My aim was to try and minimize the number of drugs the cat was receiving to maximize compliance. That's generally my approach. So I don't often see cases where I would say, you need clopidogrel and rivaroxaban, because I don't know that the combination is better. Have I used them together? Yeah, sure, absolutely. I have used them together, and I would do so again.
We tend, so even though we don't have data to support that and so on, we tend to based on what we know from humans, we tend to combine them when we are very worried, we are very concerned. So case with thrombi or thrombus or very, very thick smoke, as you were saying, we tend now to combine both drugs that hopefully will have a more holistic approach and hopefully a stronger effect on coagulation. So we do that. So in case that we are very worried, we combine them. What we have also been doing sometimes is to use clopidogrel as a first-line treatment when the cat does not tolerate, using rivaroxaban as a first-line treatment when cats do not tolerate clopidogrel, because clopidogrel is very bitter and so on.
Right.
And rivaroxaban is anecdotically easier to peel, or is not as bitter. Having said that, it's way more expensive than clopidogrel. So we balance that, the cost and the ability of the client to give clopidogrel, because I guess that's the other advantage of rivaroxaban, is hopefully it's less bitter to cats and they tolerate it a bit better. But overall, I like that we have different options, because what is always frustrating is when you don't have any option. And you may say, we don't know if one is better than the other, or if combining is better, but at least we have options.
It's a luxury to have choice and drugs that are safe and at least have some evidence behind the use of clopidogrel. That's great. We've got evidence-based medicine saying that clopidogrel is our first line. That is a luxury, especially in cats. So we've done the 12 heart diseases of Christmas. We've talked about dogs. We've talked about phenocopies. We've talked about infectious disease. We've talked about invertebrates. And we've talked about feline cardiomyopathy. What's your vote for number one, apart from the caterpillar pericarditis, which I think is a given?
I will pick one that we did not discuss on this
12.
Oh,
you can't do that.
Can I?
The 13th day of Christmas.
I was just thinking about it. And honestly, I think something that you're going to like this. Something that I think became a bit of a game changer and will hopefully even be a bigger game changer in the future is the use of transpulmonary stents to treat pulmonary stenosis. And no, I'm not pulling your leg. I think this is, and you're congrats joking. Again that you published that, because you see, this is something that many people, most cardiologists now are doing, and we had nothing. We didn't have any good option for very dysplastic type B, whatever you want to call them, pulmonary valves, especially like brachycephalic dogs, which we see nowadays. We see all the time brachycephalic dogs. They're all over the place, the bulldogs, and so the Frenchies and so on. And honestly, I think we need to wait to have long-term follow-up and so on.
Yeah.
But it's very cool. Is a procedure that has become available, or more and more people are doing in the last year, I think. And so that would be my first pick. Pulmonary stents. And congrats for your case series. And I think and not talking about anomalous coronary arteries, because they also may be a game changer for anomalous coronary arteries. So it's a cool intervention. And there you go. Sorry that I didn't pick the caterpillar pericarditis.
Well, I'm still voting for the caterpillars, and I think that's an illegal move. Although I really appreciate your positive response to the transpulmonary stents. For those of you who don't know, I've done a lot of work on transpulmonary stents and trying to refine the technique and train other people to do it. So goodness knows, we'll probably find they're terrible. Hopefully not. But we don't know the long-term outcome yet. Although my experience of them, having been doing them since 2017, is generally pretty positive. So I'm still comfortable that I think it's the right thing to do for lots of those dogs. We cannot possibly have something that I've published as the winner of the 12 days of Christmas. So let's have that as the 13th day, lucky for some. I'm going to vote. I can't vote for caterpillars, really. I think I almost want to go for something reversible, something with a nice, well-defined treatment, and something that's not very common. So obviously, toothpick pericarditis is getting my vote for number one. Jose, where are you at? What do you think?
Well done. Honestly, I think I go for the caterpillar, because it was something I have never heard before, and I think it's very nasty, but I learned something today, so it was cool.
You know why I brought it up, why I mention it, and why I love it as a thing. It's an exam question I got wrong. So
it was an exam question.
It's an exam question I got wrong. Sometimes these small trivia things count for a lot in the MCQs, don't they?
Yeah. So that's it, caterpillars and to speak.
caterpillars and toothpicks are the prime pericardial diseases, or in fact heart diseases of 2023.
Of the year. Wow.
What a duo. What a duo. I don't think any of the listeners saw that coming. Great. So I think that's it. I think 2023 is nearly done, isn't it? It's the festive season, but let's let's think about next year. Let's head into next year. Any plans, Jose, for 2024?
Yes, we can already share that we'll have a very cool and interesting podcast, a live podcast. We'll be part of the Podcast Cambridge Festival, and we will have a live podcast from the St. John's College. We have some great guests where we'll be discussing heart surgery in dogs and humans with some great guests, human and vet cardiac surgeons. So watch this space. We will tell you more very, very soon. But our season 2 opener will be a live podcast. We are very excited about it.
Super excited. And what's going to be very strange about that, not only will we be in the same place doing a podcast, which has only happened once before, but we will be hosting that in front of a live audience of 150 guests. So if you would like to attend and join us, we'd love to meet some of the listeners face to face and catch up with you guys and share some of our joy in veterinary cardiology and human cardiology too. So please look out on the social medias and web services for news about how to get tickets.
We should say already that the tickets will be free. So it'll be free tickets. So
no one's going to pay to see us. I mean, let's be honest.
True, that would be crazy, right? Maybe the students, but yeah,
maybe students.
Because they want to pass the exams. So brilliant. Hey, Kieran, it was a pleasure. Very, very cool to record this season 1 with you.
It was a pleasure.
Looking forward for 2024, and happy Christmas. Happy Christmas to everyone.
Happy Christmas. I'm off to baste a turkey and have some pudding, maybe.
Nice. Hey, all the best. Have a great 2024.
Thanks, everybody. Thanks for listening.
See you later. Bye-bye.
On the first day of Christmas, my true love sent to me a thrombus in a vascular tree. On the second day of Christmas, my true love sent to me 2 COVID cases and a thrombus in a vascular tree. On the third day of Christmas, my true love sent to me 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the fourth day of Christmas, my true love sent to me 4 TMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the fifth day of Christmas, my true love sent to me 5 kissing bugs, 4 DMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the sixth day of Christmas, my true love sent to me 6 AP windows, 5 kissing bugs, 4 DMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the seventh day of Christmas, my true love sent to me 7 caterpillars, 6 AP windows, 5 kissing bugs, 4 DMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the 8th day of Christmas, my true love sent to me 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 4 TMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the 9th day of Christmas, my true love sent to me 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 4 TMTs, 3 childhood fevers, 2 COVID cases and a thrombus in a vascular tree. On the 10th day of Christmas, my true love sent to me 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 11th day of Christmas, my true love sent to me 11 acro hearts, 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases, and a thrombus in a vascular tree. On the 12th day of Christmas, my true love sent to me 12 phenocopies, 11 acro hearts, 10 foreign bodies, 9 parchment ventricles, 8 cats with chest pain, 7 caterpillars, 6 AP windows, 5 kissing bugs, 40 MTs, 3 childhood fevers, 2 COVID cases,